Welcome, everyone, to the Best of Markham podcast, brought to you by me. My name is Igor Klibanov from FitnessSolutionsPlus.ca, your personal trainers for chronic conditions. And here with me today is Dr. Sophia Ma from Silver Spruce Naturopathic. Sophia, thank you so much for being here. Tell us a bit about yourself.
Thank you so much for having me, Igor. It's such an honor. I am Dr. Sophia Ma. I'm a naturopath at Silver Spruce, like Igor was saying. I've been in practice now. I'm moving into my 12th year of practice. In my practice, I see quite a few different conditions as a general practitioner. But my focus is typically on digestive health, chronic fatigue, fibromyalgia, hormonal health and menopause, that type of thing.
Gotcha. How did you get into that specialty of chronic fatigue, fibromyalgia, etc.?
Yeah. Well, I started practice thinking, that I was going to be geared towards dealing with geriatric health and seniors, but my practice sort of chose me, and I just started seeing more digestive issues and chronic fatigue and menopausal women. And so that's how things sort of built up naturally over the years.
Yeah, it's funny that actually in my case it's the same thing because when I was
Yeah.
personal training like 19 years ago, I wanted to work with athletes. But I was working at a community center and a country club where the majority of clients or members were women over 50. And so, I mean, most of them weren't athletes, so they came to me with the conditions that women over 50 come with, menopause, type 2 diabetes, hypertension, osteoporosis, osteoarthritis. So yeah, it's the same thing for me. I didn't choose that. I wish I could say, well, based on market research, some kind of business genius, I came up with this is the perfect market. But no, they chose me. I liked it a lot, and
Yep.
to this point, like that's all almost exclusively what I work with now. It's just like those conditions. So yeah, something that they just chooses us, and we have an interest in it, and we do a really good job with it.
Yeah. It's sort of like you think you have a plan, and then the universe just kind of serves up a different plan and you go with it, and everything just kind of flows nicely from there.
Yeah,
So
yeah, exactly.
yeah.
And more broadly, how did you get into naturopathic medicine?
So I've always known that I wanted to do something in the healthcare realm.
Mhm.
I personally was dealing with a lot of, chronic joint pain and fatigue. And I happened to be working for an organization called the International Society of Orthomolecular Medicine.
Mhm.
And that society was promoting the use of nutrients in the right dosages and amounts for various health conditions. And so I was working as an admin assistant there, and I happened to be eating lunch, and I picked up um, a newspaper. It was the NDNR, the Naturopathic Doctor News and Review. And I read an article about how a naturopath was able to help a young boy with his ADD, ADHD. And I was like, oh, this actually sounds like something I could do, and it's up my alley. And I applied, and it's, been 12 years of luckily like a very good experience as a naturopathic doctor.
Yeah. And the million-dollar question, were you able to resolve your own issues?
So, yes. So, in my fourth year of naturopathic school, I was working with a classmate of mine, and she helped me with changing my diet and making some use of some herbs and supplements, and it helped quite a bit.
That's beautiful.
So,
You're a great case study for your own services.
yeah, yeah.
Beautiful, beautiful.
And naturopathic medicine continues to amaze me each day that I practice, to
Yeah.
see the changes that people can make and how much better they can feel. It's very rewarding.
Yeah, absolutely. Especially with new advances in nutraceutical technology, in other areas, etc. So yeah,
Mhm.
absolutely. What do you like most about being a naturopath?
I really, really enjoy the connection with people. I love, meeting new people from all different walks of life, hearing their life stories. And more importantly, I really enjoy helping them sort of make the connection between things that have occurred in their lifestyle, and the changes that they're seeing, and helping to give them hope in terms of these are the things we can do to kind of bring you back on track and to a place of well-being.
Yeah, yeah. And I always tell my clients there's a million different ways to get to the same end goal. You don't there's more than one way. So it's not like if you don't do this way, it's the wrong way and you're not going to get there.
Yeah,
There's a few different ways to accomplish what you're trying to do.
exactly.
Awesome.
Yeah.
And what are you working on right now that's exciting to you?
So more recently, I got my license in IV therapy, and that's been a bit of a game changer to my practice. You know, being able to administer really large doses of nutrients to people intravenously has been very, very helpful for people to see benefit quicker. I'm also starting to work a lot with perimenopausal women and using bioidentical hormones, and I find that has been a huge change to my practice as well, and just being able to see women sort of hear them say like I finally feel myself again
Yeah.
is a really, really good feeling.
Yeah, absolutely. It really whacks you in the face when your estrogen drops 90% over a 2-year period.
Yeah.
For listeners and viewers who don't know what IV therapy is, how would you explain it to them?
So, IV therapy is being able to administer and drip nutrients into the veins. And because we're able to administer those nutrients directly into the venous system, we're able to provide nutrients in larger doses. And not only that, but we're able to bypass digestion and liver, which typically will reduce some of the absorption when you're doing oral supplementation.
Mhm.
And so the benefits seen can be quite dramatic.
Yeah. And what are some of the indications for IV therapy? Like, what are the situations when you'd use it?
Yeah, so there are many, many different indications just because you're applying like a really good dose of nutrients. So typically, I will use it with my chronic fatigue burnout patients. I have seen a lot of teachers benefit from IV therapy, especially around the beginning of the school year when they're being hit with exposures to all types of viruses from their students. And so helping to support the immune system. A lot of my colleagues' patients typically will see them for cancer supportive care. And so IV therapy can be beneficial for quite a few things.
hmm It's funny you should mention teachers because I had one client who, in fact, was a teacher in a high school, and
Yeah.
he would get IV therapy, like a really high dose vitamin C, maybe 3 or 4 times per year. If I saw her either that afternoon after she got it or the next day, her workouts would be through the roof.
Yeah.
She was in her early to mid 40s at the time, so she wasn't exactly an athlete, but still, like she'd have incredibly good workouts the day of or the day after some IV therapy.
I've had some of the same reports from my patients as well. Their personal trainers will tell them like, "Wow, you're actually lifting way beyond your personal best," or
Yeah, yeah,
so that's not unusual for me to hear. Yeah.
yeah. Like the kind of progress she would make, or the kind of weights she would lift in those workouts would be weights that I would expect her to lift if she had an additional like 4 to 6 weeks of training. But she did it in like one workout, like that day.
Yeah. It's amazing what it can do when you really give your body the nutrients that it needs
Yeah.
to sort of to function optimally, right?
Yeah, yeah.
So,
And of course, there's different things you can do with IV therapy, vitamin C, mistletoe, the Myers cocktail, etc. Uh,
exactly.
would somebody know for themselves what they need, or would they go to a professional for the professional to say, okay, based on what you have, this is what you need?
Definitely, I would say see a professional who can assess your health condition, your symptoms, do the proper blood work to make sure that your body can handle the IV therapy. And then they can also tailor like a formula that is most indicated for your health conditions, your concerns. But really, the most important thing is that they're ensuring that they can administer that IV to you safely.
Yeah, yeah. And I know you just mentioned that you can work with hormone replacement therapy. What are some of the biggest misconceptions and hesitations you find in women who need it?
Yeah, so a lot of women are concerned about the increased risk of like cancer and the increased risk of heart disease. But if you are able to use bioidentical hormones properly at the appropriate dosage and proper timing, you can really minimize some of those risks, and the benefits to hormone replacement therapy really, really outweigh those risks. And so there are a lot of studies starting to show that hormone replacement therapy can help with preventing heart disease and diabetes and weight gain beyond just improving like hot flashes and vaginal dryness and low libido, right? It really does support health more so than just minimizing menopausal symptoms.
Yeah, totally. And to add one more thing to it, I work with a lot of women who have osteoporosis, and the
Yes.
changes that I see from HRT on bone density in DEXA scans is extremely impressive. It's like on par with like the best out there with strength training, with jump training, and all you're doing is you're just taking some HRT.
Yeah. I mean, it makes sense, right? Like
Yeah,
for your hormones to go from here to here, it's a pretty dramatic transition and it's hard on the body. And so being able to kind of bring your body back up to where it was premenopausally, like it can be really helpful.
yeah, absolutely. And a lot of my clients who are on HRT, just like we said, they feel like themselves again.
Yeah. Yeah. That's a very, very common piece of feedback that I get.
Yeah.
Yeah.
So for women, we got HRT. For men, we have TRT, right?
Yep.
And
Yeah.
do you work with that as well, or is that something separate?
Yeah, so as naturopaths, we're not allowed to prescribe testosterone. But luckily, we have a new nurse practitioner who's joined our clinic at Silver Spruce. Her name's Phoebe, and
Yeah.
she's able to prescribe testosterone therapy in addition to estrogen and progesterone and some of the other hormones that we work with.
Okay. So if a guy is not feeling like himself, and he's seeing his naturopath, and he or she says, your testosterone is low, your free testosterone level is low, but you can see the nurse practitioner, and she can help you with that.
Yes, exactly.
Perfect. What obstacles have you encountered in your time as a naturopath?
Um, on a personal level, I would say the most difficult part is finding balance, right? And,
Mhm.
and I'm sure you've encountered the same thing, being as productive and busy and successful as you are and helping so many people. But sometimes it's really difficult to balance a busy practice along with, just life and spending time with family and taking vacations. On a professional level, I think the hardest part is really sometimes convincing people of their own value, that they're worthy of the care that we provide, and that uh, they're worthy of investing in their health.
Yeah, no, I can totally resonate with both of them. On the
Yeah.
balance side of things, I was once asked what advice I can give about work-life balance, and I said I'm a very bad person to give advice on that because before I met my wife, there was a 17-year span where I didn't take a single vacation. And for the since about 2009, I'm working 75 to 85 hour weeks, 7 days a week. But this is fun for me. Like I don't feel burnout, I don't feel stressed. This is interesting, this is exciting. So for me, this is a bad person to ask about work-life balance.
It's
And
hard when you really enjoy your work, right? When you feel passionate and you actually love what you do and you get a lot of fulfillment, it's hard to see it as like, oh, like I'm a workaholic, right?
yeah,
But at the same time, sometimes, my partner is like, where have you been? Why aren't you home? Right.
yeah,
So,
exactly. Yeah,
yeah.
it's hard to distinguish, is this work or is this entertainment? I mean, yes, I'm reading a book about menopause, but so it's going to help my clients. It's never going to help me. I'm never going to go through menopause, but I'm interested in it. So is this work or is this entertainment? It's a blurry line for me.
Yeah. Yeah.
Um, and what do you do in your free time?
Right now, currently, we just moved into a new home, so it's mostly rearranging furniture and reorganizing lately.
Yes.
But I'm hoping soon I'll be able to get back to my Pilates, which really helps to kind of keep me grounded, in addition to staying fit and all of that. But yeah.
Yeah, yeah. So when you're not doing house stuff, besides Pilates and fitness, anything else you do? gardening, anything, hiking, anything like that?
Yeah, I really do like taking walks and spending time in nature. So hopefully, with the weather clearing up, it's kind of again snowy out there, but hopefully we can make time to like start enjoying some spring weather soon.
Yeah, yeah, fingers crossed. I feel like right now we're in the time of year where like there's a battle between winter and spring.
Yeah, yeah.
Since this is, after all, a Best of Markham podcast, what's your favorite business in Markham besides your own? So it could be a restaurant, spa, carpenter, Pilates studio, lawyer, accountant, anything.
There are so many great places out there. I would have to give a shout out to TNT, which is a cafe down the street from us. They're like a very mom and pop's place, and I love it there because the people there are amazing. They're, it's a family based business, but they're very community oriented. So I really, really enjoy their presence along that Main Street Markham stretch. Shout out that I have to give would have to be like Soul Studio Pilates.
Yeah,
She's really changed my life. Shout out to Lisa. She's amazing, and so it's been really helpful to get back to that self care piece and taking time to do Pilates.
awesome. Where's this
Oh,
Pilates
did
studio?
I? Sorry.
Where's the Pilates studio?
Oh, it's in Cornell. So she's located. Major intersection would be Ninth Line
Yeah.
and Ninth Line and 16th ish, somewhere between 16th and 7th.
Okay, okay. I pass by the TNT bakery all the time, but I never stepped inside there. But now that they get a shout out from you, maybe I'll step inside next time I'm there. I'm actually there on Wednesday.
Yeah, they're just like the sweetest people. Like you can really, really feel the genuine warmth. Maybe not the like most healthy naturopathic like
Yeah, yeah,
certified food, but they're lovely people. So
yeah.
yeah,
That's awesome. That's awesome.
yeah.
And lastly, how can our viewers and listeners get in touch with you?
Yeah, so our clinic is located on Main Street, Markham. We're just between where the major intersection is Highway 7 and Markham Road. Best way to get through to us is either by email. So the email address is contact@silverspruce.ca or by phone. And our telephone number is 905-554-5599. Beyond myself, we are a team of 5 different naturopaths, and like I really have to give props to our clinic owner, Dr. Gail, who's put together such an amazing team. The majority of us, 4 of us, do provide IV therapy. But we all sort of have our different practice focus. We have Phoebe, who's the nurse practitioner that recently joined us. And then we also have Fiona and Bev, our massage therapists, who are amazing. And we have 2 osteopaths, a nutritionist, and we also have a psychotherapist. And so we're a very well-rounded clinic, and we are a team that share very similar values. And I would sort of promote any of them at any time. I have a lot of trust and faith in the care they provide.
That's awesome. Very comprehensive and very integrative.
Yes, yeah.
Awesome. Well, thank you so much for the information, for your time, for your expertise. We really appreciate it.
Thank you so much, Igor.
My pleasure.